Good evening, everyone, and welcome. Thank you for taking time out of your busy day to join me for this Medicare 101 guided tour. My name is Justin Kramer, and I'm a licensed independent insurance agent with Midwest Health and Life. If you're here today, you're probably here for one of these three reasons. You're turning 65 soon, you're already on Medicare and a little confused, or you're just trying to help someone through this confusing time. So let's be honest. The world of Medicare can feel like a foreign language. It's filled with acronyms, deadlines, and confusing choices. You may feel overwhelmed, worried about making a mistake, or just stressed about the cost. So my promise to you today is simple. We're going to strip away the confusion, walk through the fundamentals of Medicare step by step so you can leave here with clarity and confidence. So a little bit more about me and my family. When I'm not with my family, I'm often lending a hand at my wife's shop. A lot of you might know, barefoot and freckled. I'm officially the box opener and heavy lifter guy. Uh, I use that same dedication to simplify things for you. I'm here to be your trusted guide in finding the Medicare plan that supports your individual journey. So, about my company, I've been licensed since 2023, where I've been able to help people with their Medicare. I'm education and relationship focused. I'm available year round. And when I say that, if you call my phone, you have my personal cell phone number. By the end of the day, I might not answer it immediately, but by the end of the day, I will have an answer for you and I will get back with you. So let's talk about Original Medicare. So, Original Medicare, which is also known Parts A and B, so hospital coverage is Part A. As long as you have 10 working years or more, you or your spouse, you'll pay nothing for your Part A coverage. For your Part B coverage, now this varies depending on your income, but for most people it's $185 a month. So original Medicare enrollment scenarios. There are three scenarios. We're going to go through those here in the upcoming slides. So scenario number one, if you currently receive Social Security benefits, you'll automatically be enrolled into Original Medicare. You'll receive ID cards 3 months before your birthday, and $185 will be taken out of your Social Security check every month. Scenario number two, if you currently do not receive Social Security benefits, you must manually enroll in Original Medicare. You can do that online, over the phone, 1-800-772-1213 at the Social Security office in person, or you can mail the application to Social Security. So scenario number three, if you're still working and covered on your employer plan, you have two options. Enroll in Medicare effective on your 65th birthday, or delay Part B of your Medicare until you retire and get Part B then. So Original Medicare enrollment. Your coverage begins the first day of your birthday month. So major exposures of Original Medicare. This is for 2025. Part A hospital coverage. The deductible is $1,676 per hospital stay. Part B, you have a deductible of $257 per calendar year. Your coinsurance, you pay 20% with no limit, and you could be charged excess charges up to 15% extra. So Medicare Advantage versus Medicare Supplement. Your Medicare coverage choices. So here's what we're going to go over next. So for your first, you have Original Medicare, which we discussed as Part A and Part B. Then you can add a Medicare supplement, which is also known as a Medigap, and then you add your Part D prescription drug coverage. Or your other option other than a supplement is you can add a Medicare Advantage plan, which is also known as Part C, and that combines your Part A and Part B, and then it also can include a Part D in there, which normally a Medicare Advantage plan will have the Part D included in it. So comparing the two options, first we're going to go over Medicare Supplement. So for Medicare Supplement, you have the Part B premium, 185 a month, plus your monthly supplement plan, which we'll go over here in a bit. Coverage is the lowest out-of-pocket cost when seeing doctors and hospitals. Network, you get to choose any doctor that is contracted with Medicare in the USA, no referral needed. And then you will choose a Part D plan from a standalone prescription drug company. So next we have the Medicare Advantage plan. So you'll still have the Part B premium of $185 a month, plus the Advantage plan. Coverage, you have higher out-of-pocket cost when seeing doctors and hospitals. For networks, you must choose a specific doctor contracted with the plan. Part D is typically included with these plans, and these plans do offer extra benefits such as dental, vision, gym memberships, over-the-counter benefits, etc. So here's a look at the two, if you want to pause the screen and kind of go over that. So we always recommend a cancer and heart attack stroke for every Medicare beneficiary. You will have out-of-pocket expenses if you are diagnosed with cancer that Medicare does not cover. Amounts vary per diagnosis and treatment path. Skilled nursing care. In each benefit period, days 1 through 20, you will pay a $0 copayment. Note, if you're on a Medicare Advantage plan, you may be charged copayments during the first 20 days, depending on the plan. Days 21 through 100, $209.50 each day, and after day 100, you are responsible for all costs. So Parts A limits a skilled nursing facility coverage to 100 days in each benefit period. Your doctor or other healthcare providers may recommend you get services more often than Medicare covers, or they may recommend services that Medicare does not cover. If this happens, you may have to pay some or all of the cost. Ask questions so you understand how much your doctor is recommending certain services and if or how much Medicare will pay for them. So right here, this is in your Medicare and You book for 2025. It states Medicare covers skilled nursing facilities after a 3-day minimum medical necessary inpatient hospital stay. So that's very important. And if you look down here, Medicare does not cover non-medical long-term care. So I just wanted to bring that up. So here's what we recommend. So we have the bundle coverage options, and these eliminate major exposures that you will have. Bundle 3, which is the best coverage you can get, is a Medicare plan with prescription coverage, cancer, heart attack, or stroke plan, dental, vision, hearing plan, or a hospital indemnity plan, and a recovery care plan. Bundle number 2 has everything except the recovery care, and bundle number 1 is your Medicare plan with prescription coverage, cancer, heart, or stroke. So now we're going to go over Medicare supplements. So now we're on to the major exposures of original Medicare. Part A has the $1,676 deductible for each hospital stay. Part B has the yearly deductible plus the coinsurance and the excess charges. So you have option 1, which is your Medicare supplement, also called a Medigap. This private health insurance covers some or most of original Medicare's out-of-pocket expenses, such as deductibles, coinsurance, and copays. So now we're going to get into Medicare supplement insurance plans. There's 3 main plans we need to pay attention to here. Plan F, which you cannot get anymore unless you had Medicare before year 2020. Plan G, which is the same thing as a Plan F except you're responsible for that yearly deductible, and that deductible was $257 for this year. And then Plan N, which we'll discuss here in a little bit later in the slides. So what is the cost of a Plan G? I'm going to do this so this lady's talking over here. So the Plan G rates is $120 to $160 per month, depending on what zip code you live in and the insurance company you choose. So which Medicare supplement is the best? So a Plan G, you're going to have that premium of $120 to $160 a month. And you're also going to pay that Part B deductible for 2025. It is $257 per year. Part N, it's going to be about $20 to $40 cheaper a month, but you're going to be a little more responsible for stuff. So for instance, you're going to still have that Part B deductible, $257 for calendar year 2025. You're going to have a copay of $20 per doctor visits, all doctors, specialists included. You're going to have a $50 copay per emergency room visit if not admitted to the hospital after ER visit. And then you're going to have a Part B excess charge of 15%. So key points about Medicare supplements. When is the best time to enroll? 6 months prior to your birthday month. The reason is you're going to get the cheapest rates, you're going to avoid mistakes, and you're going to get to check it off your list. You can always make changes later. So supplement plans are standardized plans. That means supplements are federally regulated by the government. Coverage follows the letter of the plan, not the company offering it. And a Plan G for Company A is exactly the same coverage as a Plan G for Company X, Y, and Z. So myths about working with agents. Myth number one, I must have to pay a fee to use a broker to get their help with this. That's not true at all. We do not charge any fee of any kind for our service. So myth number two, nobody works for free, so the insurance company must charge a higher price if I go through a broker like you. The truth is, you will pay exactly the same price whether you use our help throughout this process or do it alone. The insurance company pay us directly for educating you and helping you enroll. So the last myth is, if you get paid by the insurance company, you must have a bias towards one company or the next. The truth is, we have access to multiple companies and get paid by whichever one you choose. So we aren't biased towards one company or the other. 3 truths of using a broker. No fees charged. The price you pay to the insurance company is the same with or without a broker. And with over 25 companies to choose from, we definitely aren't biased. So now we're going to talk about prescription drug coverage. So now we're going to talk about prescription drug coverage. So you have original Medicare, you're getting a supplement, and then you're going to have to get a prescription drug plan. And so a prescription drug plan is a private insurance company that offers Part D drug plans. You enroll into this standalone plan in order to get your prescription coverage. So there is a Part D late enrollment penalty, and this is 1% for every month you could have had the coverage but chose not to enroll. So our Part D process, we input your drugs into Medicare's online calculator. Then you let us know what pharmacy you use. We compare all plan options in your zip code. We enroll you into that plan, and then we reevaluate every annual election period, which is October 15th through December. So option one, Medicare Supplement Review. That's your parts A and B. Your parts A is going to be free. Your parts B is going to run you around $185 a month, depending on your income. Then we're going to add your Medicare supplement, which is normally a Plan G for most people, varies by zip code. And then we're going to add your Part D prescription drug plan, which is right now, it's most people pay $0 a month for that. So now we're going to get into Medicare Advantage. Option two is a Medicare Advantage plan. So Medicare Advantage plans is managed care. You must have Parts A and Parts B to enroll in a Medicare Advantage plan. Many plans include Part D prescription drug coverage. Plans can be as low as $0 premium per month, and you must pay the $185 Part B premium. So let's go over coverage. You'll have copays, deductibles, coinsurance, and out-of-pocket max. So we always recommend a bundle package with a Medicare Advantage plan. So choosing a Medicare Advantage plan. So you see what plans are available by what zip code you live in. So it varies by counties. And then we're going to make sure your doctors, hospitals, and medications are all included in that plan. And then we're going to go over any extra benefits you get with that plan, such as gym membership, dental, vision, hearing, or over-the-counter medications. How and when to sign up for Medicare Advantage. Initial enrollment is at age 65. If you'd like the plan to start the first day of your birthday month, you'll need to sign up in one of the 3 months before turning 65. Then you have annual election period. Each year between October 15th and December 7th, if you choose a new plan in this period, your coverage effective date will be the following January 1st. So here you go. You can compare the two options. Again, you can pause the screen and go over this. So we recommend for a Medicare Advantage plan, the Umbrella 3 is the best coverage. You get a Medicare plan with prescription coverage, cancer, heart attack, and stroke, dental, vision, hearing plan, or a hospital indemnity plan, and recovery care. Umbrella number 2 is a Medicare plan with prescription drug coverage, cancer, heart attack, or stroke, and then dental, vision, hearing, or hospital indemnity. And then Umbrella 1 is a Medicare plan with prescription coverage, cancer, heart attack, stroke. That's the bare minimum we recommend. Congratulations on finishing the Medicare 101. I hope it gave you some clarity. I'd be happy to talk with you one-on-one to help pick out the best plan for your situation. No pressure, just free answers and guidance. You can give me a call or text me at 515-890-2274. Again, that's 515-890-2274. Thank you for watching and you have a good afternoon.